Are dental implants safe? The truth behind this common procedure. If you are looking to replace missing teeth, dental implants are the most popular choice for lots of individuals. Like any other medical procedure, there's constantly concerns over the safety aspect as well as the risk of a potential risk. In this clip, we'll look at the risks associated with dental implants as well as the numerous factors that could impact their chances of success. What are dental implants? Implants made of titanium are posts that are surgically implanted into the jawbone to substitute missing teeth. The posts act as a base for the artificial teeth, which include crowns or bridges. This gives the patient a natural, permanent option for losing tooth. Implants are created to resemble the design and functions of natural teeth. This provides patients with improved chewing ability in addition to speech, as well as overall dental well-being. Are dental implants safe? The majority of the time, dental implants are considered to be safe and reliable method to replace missing teeth. Based on the American Academy of Implant Dentistry, the dental implant has rates of success that exceed 95%, which is an extremely trusted dental replacement methods accessible. Like all surgical procedures, there's a risk of complications and complications that may result. One of the biggest problems concerning implant dental is the chance that they will fail. The reason for this is different factors, including inadequate oral hygiene, smoking, diabetics, or other underlying ailments. In certain instances, there is a possibility that your body rejects implants, which can lead to issues such as infection or loosening of the implant. It is vital to talk about their medical history and medical issues they have with their dentist prior to having implants to limit the risks. Another risk with implants for dental purposes is periimplantitis. This is a similar condition to gum disease, which could occur around the site of the implant. The cause of periimplantitis is the buildup of plaque and bacteria within the implant area, which can lead to inflammation, infection, and even implant failing. A good oral hygiene routine, including cleaning and flossing, frequently helps prevent periimplantitis and guarantee the longevity of dental implant. Aspects that could impact the performance of dental implant. Many factors could affect the outcome implant dentistry, such as a good oral hygiene routine. Oral hygiene is vital to protecting the health of dental implants. Patients need to take their time brushing and flossing regularly to keep plaque and bacteria from buildup on the implant site. Smoking tobacco. Smoking tobacco could increase the likelihood for implant failure through affecting the body's ability for healing. Smokers must quit prior to performing surgery on implants to boost their odds of being successful. Bone density. The right bone density is required for supporting dental implants. Patients who suffer from poor bone density could require bone grafting prior to implant surgery to ensure implant stability. Health conditions. Substantially illnesses, such as an autoimmune disease or diabetes, may affect the body's ability to heal itself and raise the likelihood of failure. Patients suffering from health problems need to discuss the issues with their dentist prior to having implants. In the end, dental implants are an extremely reliable and safe solution to replace teeth that are missing. There are problems and risks associated with implant procedures. Good habits of oral hygiene, lifestyle, and health issues that are pre-existing may affect the outcome in the use of implants. Implant patients need to consult with the dentist they trust to talk about their specific risk factors and to determine the appropriate option for treating their dental health concerns. Dental implants can be a long-term investment in your dental well-being and general health. When you care for your implant and following dentist suggestions, you'll be able to enjoy a stunning and healthy dental smile for many years to come.